Dr. GSK Velu. He's the chairman and managing director of the Trivitron Group of companies, also the chairman of the Tamil Nadu State Council. Dr. Velu, you know, that point that Dr. Reddy was mentioning on preparing for a third wave, one effective way, of course, is vaccination. So I would like your comments on that. But apart from that, you know, what can be our learnings from our experience in, you know, or failings as far as handling the second wave is concerned?
Thank you, Sanket. Thanks for having me on the show. And mainly what we are looking for is, you know, we have learned a lot. In this first wave, I think we took, you know, we were not very careful about what we learned from the first wave. Particularly, see, we did a lot of healthcare facilities, even temporary facilities, and all was removed. We thought we already conquered the COVID and we started celebrating. I don't think it's just the government which is responsible. We as citizens also will let our guard down. So we should first keep the guard going on. Then second is, I think we should not look at it as any response to COVID. For example, as a country, we are not spending enough on healthcare. And we don't have enough ICU facilities. We don't have enough oxygen plants. We don't have enough, you know, ventilators. So all this has to be done as, you know, whether we have a third wave or fourth wave, we should continue to upgrade healthcare facilities. And we need to start increasing. All of us in FICCI and other organizations, we have been telling we are spending the lowest when it comes to healthcare expenditure compared to any other, you know, developing country. So we should be increasing our spending on healthcare for sure. Then another important thing is we should also keep the COVID appropriate behavior until 80% of the vaccination is completed. So I don't think we should take out masking or, you know, hand hygiene or social distancing. We should avoid large gatherings. You know, that is one of the big reasons for what we are facing today, and that should not be allowed for some time for sure. Then definitely we also have medical professionals. We, as I know, in the healthcare, we saw that there is still shortage of doctors, shortage of nurses, shortage of medical professionals. We have to start working on it. Government should do some quick recruitment. I think the frontline workers are lacking. I think both in private healthcare, we are running short of them, and government is also running short of them.
Very interesting.
So we need to start recruiting people fast. So these are all the things which we need to do. Vaccination, we know we vaccinate more, it is going to be best for the country. We can learn it from other countries like US today. They have come out of this by going for rampant vaccination. So that's important. But apart from that, I think we should overall upgrade the healthcare infrastructure in this country. And it has been a wake-up call for all of us. We cannot talk about economical growth without having healthcare sufficiency.
I think that's a very, very important suggestion. There are a lot of people who say that, you know, the healthcare budget should be at least 6% of our GDP. I don't know, Dr. Velu, how much do you think it should be? Maybe you can spell it out.
Almost now 9% of GDP. So if we on
and where are we right now? I think around 3.
Around 4%, 1.5% by government.
1.5, yeah. Okay.
1.5 by the government, 3% by private, maybe around 4.5. We have to double it minimum, if not more. And US is spending 17-18% of GDP on healthcare.
Now that's a long-term plan, but it needs to be initiated. Ideally, it should have been initiated after the first wave, but you know, these things take time.